What is masticatory myositis? Have you ever noticed your dog struggling to eat or open its mouth? This could be a sign of a condition called masticatory myositis. Let's break down what this means for your furry friend. Masticatory myositis is an autoimmune disease that primarily affects dogs. In this condition, the immune system mistakenly attacks the muscles responsible for chewing, which are known as the masticatory muscles. This attack leads to inflammation, swelling, and pain in these muscles. As a result, your dog may have difficulty or even be unable to open its mouth, chew, or eat normally. The disease often starts with an acute phase. During this time, the chewing muscles become swollen and inflamed, causing significant pain. You might notice your dog being reluctant to open its mouth, excessive drooling due to trouble swallowing, and signs of facial pain. Other early symptoms can include fever, lethargy, and a decreased appetite. However, these signs can be vague and might be confused with other issues affecting the head and mouth. As masticatory myositis progresses, it can enter a chronic phase. In this stage, the affected muscles begin to atrophy, which means they shrink and weaken due to ongoing inflammation and damage. This muscle wasting can make the bones of the head more prominent and further limit jaw movement. In chronic cases, dogs may face permanent challenges with opening their mouths, leading to weight loss from not being able to eat properly. Some dogs may even develop bulging eyes due to swelling of the muscles behind the eyes. Enlarged lymph nodes in the head and neck area are also common in advanced stages. Any breed of dog can be affected by masticatory myositis, but certain breeds seem more prone to it. Breeds like Golden Retrievers, Doberman Pinschers, German Shepherds, Labrador Retrievers, Cavalier King Charles Spaniels, Rottweilers, and Weimaraners are often seen with this condition. The average age of onset is around 3 years, but puppies as young as 4 months can also develop it. The exact cause of masticatory myositis is often unknown. However, potential triggers may include infections, vaccinations, stress, exposure to allergens or environmental toxins, and reactions to medications. The immune system specifically targets unique muscle fibers found only in the masticatory muscles, which is why this disease affects them. Diagnosis typically involves observing clinical signs and conducting specialized blood tests that can detect antibodies against the masticatory muscle fibers. Early diagnosis and treatment are essential to managing the disease and preventing irreversible muscle damage. Treatment usually includes immunosuppressive medications, such as corticosteroids, to reduce inflammation and suppress the immune response. In some cases, additional immunosuppressive drugs may be necessary. Supportive care can include pain management, nutritional support, and sometimes physical therapy to help maintain muscle function. From a veterinary perspective, recognizing masticatory myositis early is important. The symptoms can mimic other oral or neurological conditions. Prompt treatment can improve the outlook for your dog, but chronic cases with significant muscle atrophy may still face lasting difficulties with jaw function. If you notice signs like difficulty opening the mouth, facial swelling, drooling, or reluctance to eat, it is important to seek veterinary evaluation. Masticatory myositis is a painful autoimmune muscle inflammation affecting the chewing muscles in dogs. It leads to swelling, pain, difficulty eating, and muscle wasting if not treated. Early veterinary diagnosis and immunosuppressive treatment are key to managing the symptoms and preserving your dog's quality of life.